This is WFYI News Now. It's July 24th, and I'm Abriana Herron. On today's show, a southern Indiana utility company proposes a settlement in its request to raise customers' rates. The state closes the books on its fiscal year with more than $2.5 billion in reserve. And Medicaid changes have led to unanswered questions for caregivers, waitlists for patients, and skepticism for patient advocates.
With any transition, you're going to have those moments where you realize we overlooked this, we overlooked that, but it really feels like there's a lot of gaps that were overlooked.
Those stories coming up, but first, the Indiana Democratic Party is backing Vice President Kamala Harris for president just days after President Joe Biden left the ticket. The 88-member Indiana delegation to the Democratic National Convention pledged its support for Harris Monday night. Previously, the delegates pledged their votes to President Biden after he won the Indiana Democratic primary in May in an uncontested race. Indiana Democratic Party Chair Mike Schmuel says Harris will build on the successes of the Biden administration and can beat the Republican nominee, former President Donald Trump. The Associated Press reported that as of Monday night, Harris has secured the support of enough delegates to become the party's nominee for president. The Democrats will hold their national convention in Chicago for an official vote next month. The southern Indiana utility, CenterPoint, has proposed a settlement in its request to raise customers' rates. Indiana Public Broadcasting's Rebecca Thiel reports that while companies like Toyota and Marathon Petroleum have signed on to the settlement, the city of Evansville and consumer advocates have not.
CenterPoint Energy wants to recover the cost of things like replacing poles and wires, smart meters, and handling its coal ash waste. Under the settlement, the utility would get $38 million less than what it originally asked for. The average resident would now see a $35 a month increase on their bill instead of $47. But Kerwin Olson with the Citizens Action Coalition says industrial companies would also pay a lower share.
It still creates really unfair, unbalanced cost allocation that favors large industrials at the expense of residential customers and everybody else. And the community just can't afford it.
Residents with CenterPoint Energy already pay more than any other investor-owned utility in the state. The company said it was still looking over responses to the settlement and declined to comment. For Indiana Public Broadcasting, I'm Rebecca Thiel.
The Indiana Utility Regulatory Commission will ultimately decide whether to accept the settlement. Indiana closed the books on its fiscal year with more than $2.5 billion in reserve, the lowest amount since the pandemic. That's after the state spent more than $250 million to cover a shortfall in Medicaid funding. Indiana ended its fiscal year with a $421 million surplus, by far the lowest margin in the post-pandemic era, an era when, up to now, the state had been awash in federal pandemic funding. Still, Indiana was easily able to cover the fiscal year's Medicaid funding shortfall. State Comptroller Elise Nishala says that's a credit to fiscal conservatism.
That stands as a bright light, especially during this time where we are facing a national debt crisis.
The state's major tax sources grew over the last fiscal year by less than 1%, a potential warning sign for the next state budget. But Office Management and Business Director Chris Johnston says that's why robust budget reserves are important.
Give us the confidence that we'll still be able to deliver on the services.
Lawmakers will write a new state budget next year. And for our final story today, Indiana is introducing Medicaid-managed care for people 60 and up. The state launched the Pathways for Aging program this month, which includes transitioning support and services to managed care companies. The changes have led to unanswered questions for caregivers, wait lists for patients, and skepticism for patient advocates. Binta Boutier reports.
It's coming, Pops. It's coming, I promise.
For the past couple of years, this has been Matt and Jason Harding's routine. Every day, one of the brothers goes to their dad's house in Bedford. Right now, they're making his dinner.
Yeah, he likes meatballs and ramen noodles.
One of them also comes over every morning for breakfast.
Get him his pills, get him something to eat, get him cleaned up. As of right now, he's got home health care workers kind of through a rehab process that come over.
Their dad, John, has dementia. They both live in Bedford with their own families. On Matt's days, he arrives around 5:30 a.m. before work. John is just above the limit to qualify for Medicaid. Matt and Jason have hired legal aid to help with the paperwork to qualify. Matt says his dad needs help but isn't ready to be in a facility. Currently, that's the only option John has for long-term care services through Medicaid.
You're kind of in that middle range, which really, when you apply for Medicaid, works against you.
They can't afford the out-of-pocket cost for assisted living, which runs around $3,500 a month. 20 hours a week of home health aid costs around $2,700 a month. The Hardings are among thousands of Hoosiers waiting to see what Indiana's new Pathways for Aging program brings, since it took effect July 1st and replaced the Aged and Disabled waiver. Matt and Jason want their dad to receive home-based care. They've been in touch with their area agency on aging. In April, the Family and Social Services Administration created a wait list for the Aged and Disabled waiver to reconcile an $1 billion budget shortfall in Medicaid. Jana Beth Trace is an elder law Medicaid paralegal with Jones, McLaughlin, and Seifers in Bloomington. She's helping the Hardings with Medicaid paperwork.
The state just stopped, without any advance notice, approving waiver cases, and that included home health care and assisted living. So we had some cases that were already started and got stopped and denied going back to March 1st.
The FSSA says it will start to process the more than 9,000 people on the wait list, which will take nearly a year. But Trace says there are many people who can't wait that long and might be forced to use nursing homes sooner than they're ready. The Pathways program replaced the state's fee-for-service Medicaid model. The state will instead pay a flat rate to managed care entities to handle long-term care and support services. Most of this was managed by area agencies on aging. Carrie Nowlin, a resource team leader with the Area 10 Agency on Aging, says they will still help with intakes for Medicaid programs, but communication from the state and managed care entities has been minimal.
And with any transition, you're going to have those moments where you realize we overlooked this, we overlooked that, but it really feels like there's a lot of gaps that were overlooked. I wish the boots on the ground folks from the AAAs had been more involved in the planning process.
She wants to know how area agencies are supposed to communicate with a managed care entity when they've completed a person's Medicaid waiver evaluation.
Who do we notify at the MCE that we've completed that assessment and the service plan is there? Or is it just that we put in that placeholder and we're done? What paperwork do they need? There's just a lot of questions in our normal intake process that haven't been addressed.
Nowlin recommends anyone who anticipates they or a loved one over 60 will need care get on the wait list as soon as possible. She adds for people who need to take steps to protect assets, moving through the waiver process could take months. For Area 10, which serves Monroe and Owen counties, there are more than 180 people on the wait list.
Your garlic toast and your broccoli stuff. Here's a napkin for you.
Matt says figuring care out in the recently changed Medicaid system for his dad has been extremely stressful for the family. He says they're doing okay.
You want dessert?
And he worries about people in his dad's position who don't have friends or family nearby to help out.
This guy took care of me for 20 plus years. I mean, it's the least I can do.
The FSSA has not moved people off the wait list yet. The agency said in its July announcement that families should watch out for a letter in the coming months for a notification they've qualified for the waiver. For WFYI News, I'm Benta Boutier.
And that's all for today's episode of WFYI News Now. Our podcast is produced by Drew Daudelin with support from the news team at WFYI and public media journalists across the state. Our news director is Sarah Neal-Estes. Kendall Antron produced our music. And I'm your host, Abriana Herron. If you like today's episode, remember to subscribe and share, and follow WFYI on Instagram, Facebook, and YouTube to check in on our newsroom throughout the day. Thank you for listening. We'll be back tomorrow.